Bismillahirrahmanirrahim. So, hello students. Today the topic of presentation is tubular and interstitial diseases of kidney. In fact, these two are separate topics. Like we study the diseases of tubules separately and the disease of interstitium separately. But in fact, the diseases of tubules also affect the interstitium. Like those diseases which affect the tubules also affect the interstitium. So that's why we study these two diseases together. So there are two main causes of the diseases of the tubules and the interstitium. The first one is inflammation, and the second one is ischemic and toxic injury. If there is inflammatory cause, it will lead to the tubular interstitial nephritis. And if there is ischemic or toxic injury, it will lead to acute tubular injury. And if this injury is severe, it will further progress to acute kidney syndrome. This is the complete overview of this topic. Like in this topic, we studied the diseases of the tubules and the interstitium, because most of the diseases of the tubules also affect the interstitium. That's why we study these diseases combinedly. There are two main causes of these diseases. The one is the inflammation, and the second one is the ischemia or the toxic injury. If the cause is inflammation, that will lead to the tubulointerstitial nephritis, and if it is ischemia or if there is some toxic material like drugs or some immune reactions, then it will lead to the acute tubular injury and it will further progress to the acute kidney syndrome. Now we will go into the Now we will study in detail the inflammatory diseases. So, we have said before that if the cause is inflammation, then we will call it as
Interstitial nephritis.
interstitial nephritis, commonly abbreviated as TIN. So, tubulointerstitial nephritis refers to a group of inflammatory diseases like tubulointerstitium is a combined term used for a group of inflammatory diseases that affect the tubules and interstitium. I said tubulo-interstitial nephritis is a term which refers to a group of diseases, a group of inflammatory diseases which involves the tubules and interstitium. In initial stages of the tubulo-interstitial nephritis, the glomeruli are spared. Like in initial stage of tubulo-interstitial nephritis, the glomeruli are not affected. But later on, the glomeruli are also involved, which we call as glomerulosclerosis. Like the glomeruli are also scarred, they are sclerosed. Now we will divide the tubulo-interstitial nephritis diseases into two categories. In into two categories. The first one are bacterial in origin. Like this category of diseases will be caused by the bacterial infection. First of all, there will be bacterial infection which will cause the inflammation. So, and the second category we will call it non-bacterial in origin. So the first category, which is caused by bacterial infection, in this category the renal pelvis along with renal interstitium is prominently involved. In this category, along with renal interstitium, the renal pelvis is prominently involved. So we give this condition a special term which is called pylonephritis. This condition is caused by bacterial infection, and along with renal interstitium, the renal pelvis is prominently involved. So this case of TIN has given a special name called pylonephritis. And this category the tubules and interstitium is involved, but it is non-bacterial in origin. So we have given this category a special term which is called interstitial nephritis. The one which is caused by bacterial infection is called pyelonephritis, and the one which is non-bacterial in origin is called interstitial nephritis. So,
and what about the renal pelvis? Is it involved in both of these?
No. In this case, the renal pelvis is prominently involved. Like we have a radiologic image, and we see that the renal pelvis is prominently involved. So we will say that it is pyelonephritis. But in this case, not only the renal pelvis is prominently involved, but all the tubular system is involved. But in this case, there will be a prominent involvement of the renal pelvis along with the renal interstitium. So this is a pathognomonic feature of the pyelonephritis. The one, it will be caused by bacterial infection, and the second one, there will be prominent involvement of the renal pelvis. And in this case, this will not be caused by the bacterial infection, and the whole tubular system along with the renal interstitium will be involved. So you people should have a question in mind that if it is not bacterial in origin, what should be the causes of this condition? So the causes of interstitial nephritis will be, the first one will be drugs, drug-induced interstitial nephritis. Number second will be the metabolic disorders like hypokalemia. Number third will be radiations. Number four will be viral infections. And number five will be immune reactions. Now, we can have an idea that drug can also cause that condition, radiation can also cause that condition, viral infection can also cause that condition. We are already familiar with that, and immune reactions we are already familiar with that it can cause that condition. But how can hypokalemia cause that condition? So a little about this. So now, how hypokalemia causes interstitial nephritis. A research was conducted in which rats were taken and they were fed a low potassium diet, and then they were observed for changes like how the low potassium in the body causes the interstitial nephritis. When they were examined, so the researchers noticed that they have lost the peritubular capillaries. Peritubular capillaries. So, if someone lost the peritubular capillaries, there will be ischemia of the tubules, due to which there will be necrosis, and that will lead to the inflammation. So in this way the hypokalemia causes interstitial nephritis. The second way hypokalemia causes the interstitial nephritis is that low potassium causes vasoconstriction. The researchers has noted that when there is low potassium in the body, there is heavy production of the endothelin in the body, and this endothelin is, as you all know, is a potent vasoconstrictor. So it will vasoconstrict the vessels, which will lead to the ischemia, and the whole sequelae will begins ischemia, then it will have the necrosis, and after that it will be inflammation. So it will lead to the interstitial nephritis. So this was the whole story of the tubulointerstitial nephritis. Tubulointerstitial nephritis is a term that refers to a group of inflammatory diseases that involve the tubules and the interstitium. We categorize the tubulointerstitial nephritis into two categories. One which is caused by bacterial origin, and non-bacterial origin. And bacterial origin, in both the renal interstitium is involved, but in bacterial origin the pathognomonic feature is that the renal pelvis is prominently involved, and we give this condition a special name, pyelonephritis. Pylo is derived from pelvis. So it means in this condition the renal pelvis is prominently involved. And the second one is non-bacterial in origin, in which along with the renal interstitium the whole tubular system is involved, but it is non-bacterial in origin. That is the difference between the two, and we give this condition, a special name, that is interstitial nephritis, and the causes of this condition are drugs, hypokalemia, and third one is radiations, viral infections, and immune reactions. Now, the TIN, tubulointerstitial nephritis, is interstitial nephritis is divided into two types, acute and chronic, on the basis of clinical features. And second one, the inflammatory exudate. Acute and chronic tubulointerstitial nephritis are classified on the basis of clinical features and inflammatory exudate. They both have a difference in their clinical features, and we all know from our basic knowledge that inflammatory exudate is different in acute inflammation and chronic inflammation. Like the neutrophils come first in the acute stage, and in chronic stage there is no neutrophilic stage, but there are lymphocytes, plasma cells, and macrophages. So, on the basis of clinical features and inflammatory exudate, the tubulointerstitial nephritis is divided into acute and chronic types. Now we will study the acute pyelonephritis. Pyelonephritis, we already know, it is the inflammatory condition of the renal interstitium and the renal pelvis that is caused by the bacterial infection. Inflammatory condition of kidney and pelvis, but caused by bacterial infection. That is differentiating feature. And this condition is a complication of the urinary tract infection. Like, first of all, we will have a urinary tract infection, and from that infection the organism will spread upward into the renal pelvis and the kidney, and after that we will have an infection and inflammation of the renal pelvis and the renal interstitium. Understand?
No.
Like, first of all, we will get an organism through the urethra.
Yes.
And through the urethra, the organism will ascend into the bladder, and from bladder through the ureter, it will ascend into the renal pelvis and the kidney. And as we said, pyelonephritis is an inflammatory condition of the kidney and the pelvis, the renal pelvis. So the organism should reach the kidney and the pelvis to cause this condition.
Yes.
So first of all, we will have the urinary tract infection, lower urinary tract infection, and from there the organism will spread up to the kidney and the pelvis to cause this condition. So, pyelonephritis is a complication of the urinary tract infection. And this urinary tract infection can be a lower urinary tract infection or upper urinary tract infection. In lower urinary tract infection, we have urethritis, prostatitis, and cystitis. And in the upper urinary tract infection, we have pylonephritis, so this condition is a complication of the urinary tract infection. So now there are two ways by which the organism can reach to the renal interstitium and the pelvis to cause this pyelonephritis. And these are, number first is ascending infection. And number second is hematogenous infection. In this case, the organism will ascend from the lower urinary tract to the upper urinary tract and will cause this condition. Like we will get the organism through our urethra, and through this tract to the it will ascend through the bladder, through the ureter, and will reach the kidney and the pelvis and will cause the pyelonephritis. And in this condition,
Fluids through the blood.
the organism will reach to the kidney and the pelvis through the blood. Like in case of septicemia or infective endocarditis. The organisms will reach to the kidney and the pelvis through the blood and will cause the pyelonephritis. So there are two ways by which the organism can reach the kidney and the pelvis to cause the pyelonephritis. The one is the ascending infection. It is named ascending infection because the organism ascend through the urinary tract to cause the pyelonephritis. And this one, the organism will reach the kidney through the blood. And it usually occurs during the course of the septicemia and the infective endocarditis. Now we will go. So now we will study the pathogenesis of the
Pyelonephritis.
Pathogenesis of pyelonephritis. So first of all, we will study the causative organism, like the organism which causes the pyelonephritis. The most common organisms are the enteric tract organisms which causes this condition. First of all, it enters the urinary tract and causes the urinary tract infection, and within the urinary tract they ascends up to the upper urinary tract and causes the pyelonephritis. Among the enteric tract organisms, E. coli is the organism responsible for most cases of pyelonephritis. E. coli is the organism which is responsible for most cases of the pyelonephritis, and it is the organism which causes the primary infections. So later on you people will know that what does mean by the primary infection. And the other organism, the mnemonic for it is K. Remember. From K it is Klebsiella.
E. coli.
E. coli.
E. Enterobacter.
Better. Proteus renal.
And third one is Proteus. And fourth is Pseudomonas. These organisms do not cause the primary infections. In fact, they causes recurrent infections. So hope now you people know what is the difference between the primary infection and the recurrent infection. Like if a person is sterilized and he or she do not have a urinary tract infection before, so E. coli is most responsible organism in such people for causing the urinary tract infection. And Klebsiella, Enterobacter, Proteus and Pseudomonas, these are the organisms responsible for the recurrent infections. But in those individuals who have lower urinary tract manipulations, like if they have undergone some surgeries in the urinary tract, and second, if they have some congenital anomalies. So these organisms are responsible for causing recurrent infections in populations having lower urinary tract surgeries or having some congenital anomalies of the lower urinary tract. First of all, the organism will enter the urinary tract and it will attach to the mucosa of the urinary tract, and there it will start multiplying, and through the expansive growth of the colonies they will reach up to the bladder. And now in bladder the urine is already infected. So now a little about the anatomy and the antimicrobial properties of the bladder. The urinary bladder has two important antimicrobial mechanisms, two protective mechanisms against the UTI. The first one is mucin, produced by bladder mucosa. The bladder mucosa produces this product mucin, and it lines the mucosa of the bladder, and it do not allow the organism to attach to the bladder mucosa. So if the organism do not attach to the mucosa, it will not invade the mucosa and it cannot cause the infection or inflammation. And the second one is the flushing mechanism. And in a sense, we can also call is voiding of urine. There is periodic voiding of the urine from the bladder. So the urine flushes the organism, the infective organism along with it to the outside. So it cannot cause the infection anymore. So these two are the protective mechanisms of the urinary bladder. The first one, that it produces the mucin, which lines the bladder mucosa and it do not allow the organism, the infective organism, to attach to the mucosa of the bladder. And the second one is the periodic flushing mechanism, which flush the organism to the outside and do not allow it to the attach to the bladder mucosa to cause an infection. And now the something about the anatomy of the bladder, which also have some protective role against the UTI. Now this is the bladder and ureters, the two ureters. As the ureters reach the bladder wall, they do not cross the wall perpendicularly, but they crosses the wall of the bladder obliquely, like this way, and obliquely, and in this way it creates a wall mechanism. It means that there is one way flow of the urine, like the urine can flow into the bladder, but it cannot flow out of the bladder into the ureter. Why? Because as the urine accumulates in the bladder, it will create a pressure and it will exert a pressure on the ureter and will compress the lumen of the ureter, so that the urine cannot pass in the backward direction through the ureter. Now, if a child have a congenital anomaly that the ureter passes the wall of the bladder perpendicularly, so this child has lost the protective mechanism of the wall mechanism. So as the urine accumulates in the bladder, it will move in the backward direction towards the kidney, and this is called causative reflux. Now, if we have an organism get into the urinary bladder and it infects the urine of the bladder, and a child have this congenital anomaly, so this infected urine will be propelled in the backward direction into the kidney. So in this way, through the infected bladder urine, the organism will reach to the kidney and will cause pyelonephritis. So this is a protective mechanism of the bladder. This anatomical arrangement is a protective mechanism to avoid the pyelonephritis. This was something about the anatomy of the bladder. Now we will move to the risk factors of the pyelonephritis. Now, risk factors. The first risk factor is instrumentation. Like if we introduce an instrument into the bladder, like catheterization, or cystoscopy. Through these instruments, we can introduce an organism from the urethra or from the environment directly into the bladder, and there it can cause a lower urinary tract infection, and there is a risk that this lower urinary tract infection can spread into the kidney, and it will cause the pyelonephritis. So the first risk factor is the instrumentation. But in the absence of instrumentation, the cases of pyelonephritis are more common in females. Like if we talk about the instrumentation, so through the instrumentation, pyelonephritis can occur in males, but in the absence of instrumentation, like without the instrumentation, the cases of pyelonephritis are more common in females. There are three main reasons due to which the pyelonephritis is more common in females. The first one is short urethra, shabash. Number second, their urethra is in close proximity
To the anus.
to anus. And number third, there can be a trauma to the urethra during sexual intercourse. And this trauma then favors the attachment of the infectious organism into the walls of the urinary tract. So these are three reasons due to which the cases of pyelonephritis are more common in females. The first one is the short urethra. The second one, the urethra is in close proximity to the anus. And the third one, there can be a trauma to the urethra during sexual intercourse, which favors the attachment and colonization of the infective organisms. Now, the second risk factor is the stasis of urine. As we already discussed that one of the protective mechanism of bladder is the flushing mechanism. So if there is stasis of urine, the flushing mechanism is lost, and the infective organisms can divide within the static urine undisturbed. So, and they can easily attach to the mucosa of the urinary tract and can cause infection. So the second risk factor is stasis of urine, and on the basis of this point we will discuss some cases in which the events of the urinary tract infections are increased. So now we will discuss the increased incidence of the urinary tract infections in benign prostatic. What next? Hyperplasia. In this condition, the size of prostate is increased and it squeezes the urethra. So there is an obstruction of the urinary tract and there will be a stasis of urine. So now you people know that what stasis of urine causes. It will allow the infective organism to divide undisturbed and will easily attach to the mucosa of the bladder and will cause infections. And number second is the pregnancy. And pregnancy, there's increased incidence of urinary tract infection because during pregnancy the size of uterus is very much increased and it exerts a pressure on the urinary bladder and ureters. And due to these pressure on these structures, there will be a stasis of urine. And in turn, there will be an increased incidence of the urinary tract infection. Now, the third condition we will study is the diabetes. During diabetes, there is decreased immunity. And if immunity is decreased, there is increased susceptibility to infections. So in turn, there will be an increased incidence of the urinary tract infection, decreased immunity. So there is an increased susceptibility to infections, and there will be increased incidence of the urinary tract infection. And number second, there will be a neurogenic bladder dysfunction. Because we already know that in diabetes, the peripheral neuropathies are very common. So there will be a neurogenic bladder dysfunction. So in turn, there will be a stasis of the urine because the bladder is not functioning well. So there will be a stasis of urine because the urine are not periodically voided. So this will allow the organism to grow undisturbed and will be easily attached to the mucosa of the bladder and will cause the infection, and this infection can further spread into the kidney and the renal pelvis is we are discussing this term. So we are done with the risk factors of the pyelonephritis. So now we will study about the mosaico uterine reflex. This is the main mechanism by which the lower urinary tract infections spread to the upper urinary tract and that causes the pyelonephritis. It is because of the congenital anomalies. As I have already told you that there is change in the orientation of the ureter entry into the bladder, because instead of the oblique entry it enters into the bladder perpendicularly. So when their pressure increases, there is a backward flow of the urine through the ureter into the kidney, and that urine is infected which reaches the pelvis and the renal interstitium, and there it causes the infection. In 20 to 40% of the children with UTI, they have this condition, mosaico-ureteral reflex, and this is because of the insufficiency of uterovesical valve. 20 to 40% of children with UTI, they have congenital anomaly of insufficiency of uterovesical wall, and due to this they create this vesico-uteral reflex, due to which the infected bladder urine reaches the kidneys and there causes the infection. And it can also be acquired. During flaccid bladder dysfunction, due to spinal cord injury. And number second is bladder dysfunction due to diabetes. So this thing is acquired during these two conditions. In spinal cord injury, there will be flaccid bladder dysfunction, and there will be a vesico-uteral reflex. And during diabetes, there will be a bladder dysfunction, so there will be a vesico-uteral reflex. And this vesico-uteral reflex has an active mechanism.
In causing.
It has an active mechanism by which the infected bladder urine is propelled up to the pelvis and then to the kidney. So this is called vesico-uteral reflex, and this is called intra-renal reflex. So the infected bladder urine reaches up to the pelvis and then to the kidney, and the propulsion of the urine to the pelvis is called the vesico-uteral reflex, and to the kidney is called the intra-renal reflex. And this is an active mechanism by which the infective organisms reach the kidney, and there it causes the infection and inflammation, which is a condition called pylonephritis. Other risk factors for the UTI include pre-existing renal conditions, with renal scarring. Number second is immunosuppressive therapy. And number third is immunodeficiency. Got it? So these three are the furthermore risk factors. The first one we studied was the instrumentation. The second one was the stasis. So these are the additional risk factors for the UTI. But first is pre-existing renal condition with renal scarring. Number second one is the immunosuppressive therapy, and number third is the immunodeficiency. In these conditions, we will frequently get the urinary tract infection because it is the most exposed site to the organism to get into and cause an infection. So now we will study the morphology of pyelonephritis. First of all, the gross appearance. So it can involve one or both the kidneys. This condition can involve one or both the kidneys, and the second point is that the affected kidney can be normal in size or enlarged. It can be normal in size, the affected kidney can be normal in size or enlarged. And there will be discrete yellowish raised abscesses. There is discrete yellowish raised abscesses grossly apparent on renal surface. So there will be discrete yellowish raised abscesses, like the surface of the kidney will be raised from its normal surface. There will be discrete yellowish raised abscesses grossly apparent on the renal surfaces, and these abscesses can be widely scattered or limited to one area of the kidney, or these abscesses can join to each other and will form a large area of the abscess. Like many small abscesses, they will come together and will join each other and will form a large abscess together. So these abscesses, furthermore, I said that these abscesses can be widely scattered on the surface of the kidney, or they can be limited to one area of the kidney, or they can join to each other and will form a large area of the abscess. And book they have written that they will form a large area of separation. So now we will move to the. So after gross appearance, now we will study the histologic features. In histologic features, we will appreciate number first the liquefactive necrosis. As we have studied in our basic pathology that liquefactive necrosis occur in areas of the infection. And number second, we will appreciate the abscess formation in renal parenchyma. There will be an abscess formation in the renal parenchyma. On histologic grounds, we will appreciate these two things. The first one is the liquefactive necrosis, and the second one abscess formation in the renal parenchyma. And now the high yield point is that in this case we will appreciate WBC cast. It is an infection and inflammation of the tubules, and so there will be an infiltration of the neutrophils. These neutrophils will extend up to the collecting ducts. These neutrophils will extend up to the collecting ducts, and there they will form the WBC casts, and these casts will appear in urine. Is in nephritic syndrome, we were appreciating the RBC cast. So in acute pyelonephritis, we will appreciate the WBC casts in urine, and it is because that the large masses of the neutrophils in the tubules will extend up to the collecting ducts, and there they will form the cast which will appear in the urine. So on histologic examination, we will appreciate these three things. The first one is liquefactor necrosis, second one abscess formation in the parenchyma, and in the urine we will appreciate the WBC cast. Now we will study another condition which is called pyelonephritis. This condition, we will study this condition in the next lecture.